Imagine discovering something so bizarre happening to your body that you can't bring yourself to tell anyone. Not your friends, not your family, not even a doctor. For 2 entire years. That's exactly what happened to a 33-year-old man who experienced one of the most unusual medical complications ever documented. After every intimate moment, instead of the normal biological process, he would ejaculate from his anus. Not once, not twice, for 730 days straight. This isn't science fiction. This is a real case published in medical literature, and it reveals something profound about how our bodies can adapt, malfunction, and surprise even the most experienced physicians. But here's what makes this story truly fascinating. This man's silence wasn't just about embarrassment. It was about a perfect storm of psychological barriers, medical complexity, and a complication so rare that most doctors will never encounter it in their entire careers. Let's start with what actually happened.
5 years before this bizarre symptom began, the man had surgery to remove a tumor in his pelvic area. The surgery was successful. The tumor was gone. But what the surgical team didn't realize was that the procedure had created a microscopic pathway, a connection between his urinary and digestive systems that shouldn't exist. In medical terms, this is called a fistula. Think of it like an unauthorized tunnel between 2 subway lines that were never meant to connect. For years, this tunnel remained dormant, undetected, causing no problems whatsoever. Then, something changed. The fistula expanded. Suddenly, during ejaculation, semen, which normally travels through the urethra and out through the penis, found a new route. It would flow backward, enter the fistula, and end up in the rectum instead. From a physics perspective, this makes sense. Fluids follow the path of least resistance. From a human perspective, this is absolutely terrifying.
Imagine your body suddenly rerouting one of its most fundamental biological function without warning, without pain, without any clear explanation. Now here's where the psychology gets fascinating. Why did this man wait 2 full years before seeking help? Research from the Journal of Sexual Medicine shows that men experience profound shame around sexual dysfunction, often rating it as more distressing than serious chronic illnesses. Dr. Abraham Morgentaler, a urologist at Harvard Medical School, has documented how male patients will endure symptoms for years rather than discuss anything related to their genitals or sexual function. This isn't weakness. It's a deep-seated cultural conditioning that tells men their sexual performance defines their worth. When that performance becomes abnormal, many men feel they're breaking a fundamental rule of masculinity. But there's another layer here. This particular symptom was so unusual that the man probably questioned his own sanity.
Have you ever experienced something so strange that you wondered if you imagined it? When your experience falls completely outside the normal range of human biology, it creates a peculiar kind of isolation. You can't Google it and find a community of others with the same problem. You can't casually mention it in conversation. You exist in a medical no man's land, where your reality seems impossible even to yourself. The medical detective work that finally diagnosed this condition is equally remarkable. When the man finally visited a urologist, doctors performed what's called a retrograde urethrogram. Essentially, they injected contrast dye into his urinary tract and watched where it went using X-ray imaging. The dye revealed the fistula clearly, a small but significant connection between the prostatic urethra and the rectum. Dr. Rina Malik, a urologic surgeon, explains that these fistulas are extremely rare, usually occurring after pelvic radiation therapy, complicated surgeries, or severe infections. They represent a failure of the body's normal compartmentalization, where systems that should remain separate become merged. Treatment involved surgical repair, carefully closing the fistula and reconstructing the normal anatomy. But here's the critical insight that extends beyond this single case. The human body contains dozens of potential weak points, where organs sit adjacent to each other, separated only by thin layers of tissue. After trauma or surgery, these barriers can fail. Fistulas can form between the bladder and vagina, the intestines and skin, the esophagus and trachea. Each creates its own nightmare scenario of bodily fluids or contents going where they absolutely shouldn't. What this case really teaches us is about the hidden epidemic of medical silence.
A 2019 study in JAMA Internal Medicine found that up to 50% of patients fail to disclose important symptoms to their doctors due to embarrassment, fear of judgment, or uncertainty about whether their symptoms are serious enough to mention. This silence can be life-threatening. Rectal bleeding gets dismissed as hemorrhoids until it's stage 4 colon cancer. Chest pain gets ignored until it's a heart attack. And bizarre symptoms like rectal ejaculation get endured in private shame for years. If you're watching this and you've been living with a symptom that seems too strange or too embarrassing to discuss, understand this. Medical professionals have seen everything, literally everything. What feels earth-shatteringly abnormal to you is data to them. That weird thing your body is doing, someone else's body has done it before, and there's probably a medical term for it, a diagnostic test for it, and a treatment for it.
Your job isn't to determine whether something is serious enough. Your job is simply to report what's happening. The man in this case eventually made a full recovery after surgical repair. His body returned to normal function, and that terrifying 2-year chapter of his life ended. But his story remains a powerful reminder of how our bodies can surprise us, how shame can silence us, and how the gap between experiencing a symptom and seeking help can stretch across years of unnecessary suffering. So here's your action step. If something about your body has been worrying you, anything at all, no matter how strange or embarrassing, write it down right now. Not tomorrow, not next week. Now. Book an appointment with a doctor and bring that written note with you. You don't even have to say it out loud initially. You can hand them the paper, but break the silence. Because the most dangerous medical condition isn't the rare fistula with the unusual symptom.
It's the conspiracy of silence we maintain with ourselves, pretending that if we ignore something long enough, it will simply go away. It won't. Get help. Your future self will thank you.